So good morning, everyone. Today we're getting ready to do our HIPAA, the Road to Compliance webinar. Give it a few more minutes for people to log on. We had a technical glitch and a number of people got disconnected. So here's hoping that they find their way back. We'll give them a few minutes to do that. And I will be back with you in a couple of minutes. Just go ahead and hang tight. Just a couple of more minutes and we'll go ahead and get started. Okay, let's go ahead and get started. Welcome to today's webinar, HIPAA, the Road to Compliance. My name is Roger Schindel. I'm your presenter today, and this is being presented by HOSPICE Compliance Solutions. So again, thank you for joining us. I want to tell you a little bit about us as a company. We've been in business over 7 years. I'm the president and CEO. I'm certified for my privacy and cybersecurity and auditing credentials through HIPAA with my CHPS and through ISACA for my CISA. Everybody who works for the company and is working on client projects is certified by one or more of what we consider to be the best of the best associations. Have been around a number of years, are highly well regarded in the industry. These include IMS, that just finished its annual convention in Las Vegas last week, HIPAA, ISC Squared, ISACA, IAPP, the International Association of Privacy Professionals, and the Healthcare Compliance Association. So today's agenda, we're going to do a little bit about who we are, which we did some already. We're going to discuss why HIPAA, privacy and security should be on your radar. We're going to talk about some of the basic components for HIPAA compliance that you should be aware of. Help you assess your own compliance with the regulations, introduce some new threats you face, and discuss, of course, how we might be able to be helpful to you. So let's go ahead and get started. During the presentation, if you have any questions, go ahead and raise your hand. Typically, we're going to wait until the end of the presentation to answer those questions. Additionally, throughout the presentation, we'll be posting in the chat box some URLs that will be active and live and you can click on if need be. So let's go ahead and get started. So, HOSPICE Compliance Solution, our current iteration began in 2012. All we do is work with HIPAA compliance along with other privacy and security for small and mid-sized organizations. That would include medical practices and their business associates. Medical practice we define as anybody who is using medical information. So it's physicians, psychologists, dentists, chiropractors, and the like. We currently have 5 professional staff and 4 professional staff or support staff. Our home office is in Crown Point, Indiana, which is outside Chicago. We also have a presence in Chicago, in Augusta, Georgia, in Iowa, and in Omaha, Nebraska. Some of our clients include folks like community health centers, counties, so we do work with government agencies. And in Iowa, they have something called behavioral health regions, which are essentially county-sponsored mental health programs. We work with insurance companies who fall under the HIPAA regulations as covered entities. As I said earlier, physicians, dentists, and chiropractors. We do home health, hospice, and wound care. We also work with business associates. Those are folks that work with your protected health information on your behalf, and those tend to include software companies. So if you're using an electronic health record, they're going to be a business associate. Typically, your internet service provider, if you're doing anything out on the cloud, will be a business associate. If you have a web portal that's being run by someone else, that would be a business associate. We also work with others, such as data destruction and storage companies. So all those are business associates. We'll talk about it a little bit later, where you need to be concerned about their compliance with the HIPAA regulations, because in fact, you can now be held liable for breaches that they cause using your information. So why should HIPAA compliance be on your radar? Now let's talk about HIPAA compliance in the terms of privacy and cybersecurity. HIPAA is not a regulation that has no meaning to it. It's not an attempt for the government to foist regulation on you. The idea is to keep your patient or client's information private, safe, and secure. So why should you care? So first of all, there's identity theft. Most medical records will contain the kind of information that can lead to financial identity theft, but additionally, there's medical identity theft, which includes not only financial information, but healthcare-related information that can be used for fraudulent practices. If you have a breach, you can be subject to fines and penalties, both at the state level and at the federal level. So when we talk about HIPAA, we're actually talking about a series of regulations at the federal and state level that address privacy and security that you need to be aware of. Aside from fines and penalties from the governmental organizations, you can be liable for civil penalties. More and more, we're seeing large civil suits being brought, class action suits around breaches. There have been some court cases that have defined compliance with these regulations as a standard of care, which opens you up to significant civil fines and penalties, or civil penalties and judgments. You have ethical and professional standards. Many of the professional associations now include in their standards a requirement for privacy and security. It's just good business sense. What we always ask our clients to think about is, what do you want to have happen to your information, and do you want to make sure that your providers are keeping your information private, safe, and secure? The idea being that your clients, patients, expect you to take the same care with their information as you would expect another provider to take care with your information. And of course, the last item is the new age of cybercrime. It's difficult to turn around on any day and not hear of one or more large breaches, either of medical information or financial information. So more and more, we're seeing technical breaches, where historically most of the breaches we saw were on the privacy side. Okay? So to kind of drive this point home, let's talk about some folks who didn't pay attention to their privacy and security requirements. So the first one is ANCHORAGE Health Services. Their breach was unauthorized access and disclosure. They had failed to patch their data systems were running outdated software, which resulted in a breach of over 2,700 records, which resulted in a $150,000 fine from the feds. This might sound familiar. If you remember back to last summer, there was the WannaCry cybersecurity incident, the ransomware that occurred. It only hit organizations that were still running Windows XP. The idea being that one of the issues you need to be concerned about when you're talking about privacy and security is making sure that your information systems are up to date. All systems have vulnerabilities. The example with the Windows XP, Microsoft doesn't provide security patches to it anymore. The vulnerabilities continue to be discovered, so it was relatively easy for the hackers to get into those systems. So when OCR, Office for Civil Rights, came in to investigate, these are the things that they found. These are relatively common, that Anchorage community had not done a security risk assessment. They didn't have adequate policies and procedures to protect their PHI, or in this case, EPHI, which is electronic protected health information. And they failed to implement technical security measures to reduce the risk to the EPHI. If they had done a security risk assessment, they would have uncovered the fact that they were running out-of-date software and would have had the opportunity to patch their systems prior to having to pay $150,000. Next one we're going to look at is Affinity Health Plan. This is a classic where Affinity had almost 350,000 records disclosed because they didn't erase the hard drive on their photocopier. What many people don't understand, that in today's environment, anything that does a scan of a document, like a photocopier, a printer, or a fax machine, actually keeps a copy of that image on the hard drive, and you're required to have sufficient protective policies in place to make sure that you address that information prior to releasing that device back to whoever you leased it from or sold it. So they were fined a little over $1.2 million. Affinity had failed to basically do a security risk assessment that would have identified those vulnerabilities, and then they failed to implement policies and procedures for the disposal of PHI with regard to the copier hard drives. So one thing I want you to understand as we go through these, that the fines that are assessed are not based upon the size of the breach, but rather the level of compliance that an organization has regarding their privacy and security programs. So while not stated within the regulations, as you look through the different breaches that occur, the trend that does pop up is that the regulatory agencies are more concerned about the level of compliance than they are the size of the breach. So here's another breach. This one was Parkview Health Systems. So in this case, Parkview took control between 5,000 and 8,000 patient records of a retiring physician as the patients were being transitioned to a new provider. Parkview employees who knew that the physician wasn't home left boxes of the records on the physician's driveway. Parkview was fined $800,000 and was required to implement a corrective action plan. Essentially, they didn't have written policies and procedures or adequate training, which is what caused the breach. So a couple items here. One is that OCR, Office of Civil Rights, and the other regulatory agencies take the position that virtually all breaches occur from a lack of adequate training. We'll talk about it a little bit later, but one of the things people tend to shortcut is doing adequate training around HIPAA policies and procedures. When I presented this as a training to one of my clients as some background information. They made the comment that you just can't train stupid. I mean, the idea of leaving protected health information boxes in someone's driveway next to a busy street is difficult to fathom. But again, because of a lack of training, that's what we ended up with. The other item I would like to point out is this required a corrective action plan. When you have a breach, if it's of sufficient size, the regulatory agencies, particularly OCR, Office of Civil Rights, has the right to, as part of the negotiated settlement, to implement a process by where they control and have the opportunity to audit and monitor your privacy and security program, typically for a period of 3 years. And the last thing you want to do is have a regulatory agency looking over your shoulder at your security and privacy program. So the next one, this is Hospice of Northern Idaho. This is a typical breach. They had a loss, actually a theft. This was 441 records. Problem here was the records were on an unencrypted laptop. So Hospice was fined $50,000. HHS, Human Health Services, who oversees Office for Civil Rights. And so when you see these, we'll be talking about HHS and OCR interchangeably, found that Hospice had not conducted a risk assessment, which would have identified the fact that they were maintaining data at rest on an unencrypted device, which is something that you don't want to do. Some people look at encryption as being very difficult. It's actually relatively easy and not terribly expensive if you have, if you're using Windows, for example, or Apple's I/O. Most often, depending on what version, you have encryption software built into the operating systems. Okay, they also failed to have necessary policies and procedures in place to address mobile security. And the idea here was that OCR is concerned about privacy and security irrespective of the size of the organization. So this is a relatively small organization. This is actually the first time that a small breach, which is a breach of less than 500 records, was actually fined. That's not the case anymore. On a daily basis, we're seeing organizations, small breaches being fined. There's a couple later on where we're talking about 2 and 3 records. So here's North Memorial Medical. North Memorial Medical actually acted as a business associate to a company called Atriva. Excuse me. So North Memorial provided Atriva with access to so I have it backwards. Atriva was the business associate. North Memorial was the covered entity, provided access to their PHI without obtaining satisfactory assurances in the form of written business associate agreement that Atriva would safeguard the PHI. So what happened was an unencrypted, password-protected laptop was stolen from the business associates' workforce members' locked vehicle. It was only 10,000 records, but it ended up being a $1.55 million fine, which was assessed on North Memorial Medical. So now we're seeing, as the regulations stipulate, that individuals, covered entities, can be held liable and will be held liable for breaches that their business associates caused. We're going to talk about this in a little more depth later, but that triggers the requirement for you as a covered entity to investigate your business associates to make sure that, in fact, they're complying with the HIPAA regulations. Having a business associate agreement in place is now not sufficient protection. All that changed in 2013, and we'll talk about that a little bit later. So again, you can see here that North Memorial failed to perform a security risk assessment and have a risk remediation plan. They didn't have anybody in charge of the business social relationship. They're required to revise and redistribute their policies and procedures, and again, provide adequate training to all workforce members. Okay, this breach I kind of like. I always point it out. It's kind of like a reality show segment. So this one was only 270 records, but it generated a fine of almost $240,000. So here's what happened. The ex-husband of an employee for Lincare reported to Lincare and OCR that his ex-wife had left PHI of patients in the car, and she left the car with him. He also found PHI under their bed and in a kitchen drawer, so basically paper records were just being strewn around. At the time, with Lincare, employees were allowed to take PHI from the premises and were actually ordered as part of their backup to keep copies of documents in their car in the event that something happened to the building. So not a well thought out backup plan for your protected health information. So OCR stated that covered entities, including home health providers, must ensure that workforce members take protected health care information off-site. There are adequate policies and procedures that provide for reasonable and appropriate safeguards. That's something when you dig into the regulations you're going to hear over and over again. HIPAA attempts to use the reasonable and appropriate level of compliance in implementing the regulations. And the protection needs to be not only for electronic information, which is what many people focus on, but also for paper, information on paper, which is one of the large areas where even today we see breaches and fines occurring from the theft or loss of paper records. So Hollywood Presbyterian, this was an unauthorized disclosure. So one of the things that happens is with ransomware, OCR, Office of Civil Rights, and Homeland Security have deemed that any kind of successful ransomware attack is a suspected breach until you can demonstrate that there was a low probability that anybody actually accessed the records. That's actually a difficult thing to do unless you have adequate technical security in place. One of the things you want to do around that technical security is have log files of data transmitted across your firewall. You want to have a baseline of data usage across the firewall, because when you have a ransomware attack, if data is being accessed, you'll see a spike in data across your firewall. If you don't see the spike, you can make a reasonable assumption that data was not compromised, although you also need to understand that the median length of time between when malware gets on your system, even for a ransomware attack, and where when the attack actually discloses itself is 120 days, right? So you have malware sitting on your system typically for up to 4 months before you actually become aware of that malware on your system, unless you have appropriate safeguards in place and are reviewing log files and such to be able to identify malware on your system and malicious actions. So here's some recent ransomware attacks. And the reason I bring these up is because I want to show you that these attacks don't necessarily only occur in large hospital groups, but actually will occur in small organizations. Something like a third of all cyber attacks are on small practices and organizations. That's a practice of less than 15 physicians. And the reason for that is these attacks are automated. The malware just floats around on the internet, finds an unsecured IP port, internet protocol port. It can identify the device that port is associated with. And the unfortunate thing is 80% of all devices never have their factory default security settings changed. And so once a piece of malware has identified a device through an open IP address, they can check to see if the security settings have been changed. If they haven't, they now have egress into your system. So a couple things you need to be aware of, and all those would be percolated up, and you would see them if you do an adequate security risk assessment, which unfortunately, as we saw in many of those breaches, people just aren't doing. So how do you protect yourself? So that's where HIPAA actually comes in. So the items that you want to look at is the basic items are you want to conduct a risk assessment, both on your security systems and your privacy side of the house. You then need to create a remediation plan. So the risk assessment percolates up areas of high risk vulnerabilities. The remediation plan gives you a roadmap to, as it says, remediate those vulnerabilities. Then once you have the plan, you want to work through it and correct any deficiencies. You then need to audit and manage on an ongoing basis your privacy and security program. Unfortunately, few organizations do this, which leaves them open to being on the wrong side of the regulatory agencies when they have that inevitable breach. The statistics say that you're likely to have at least one breach every 24 months. And that's not just security incident, but a breach that needs to be reported. And then you have a 60% chance of having at least 5 breaches that need to be reported in that 24-month period. And I would say that's pretty spot on in our practice. Many of the breaches that we see are small and negligible, but they still need to be reported. And the benefit of having all your ducks in a row on your privacy and security is the regulatory agencies are more concerned about making sure you're doing everything you can to keep a breach from occurring and everything you can to remediate it once it occurs than worrying so much about the fact the breach has occurred, because they recognize the fact that you can't keep all breaches from occurring. And then, of course, as we pointed out earlier, you need to have adequate training all through the process. As I said earlier, the regulatory agencies take the position that all breaches can be traced back to a lack of adequate training, and I don't disagree with that. You need to train, and train some more. We'll talk about that in a little bit. So the risk assessment, let's start with that. So the risk assessment needs to be done in a very specific way. The protocol that everybody refers back to is the NIST, National Institute of Standard Technology. They have a special paper, 800-30, that explains how to do the risk assessment. I'm going to show you what that means in just a second. Once you've done the assessment, you need to generate the remediation plan, as we talked about on the previous slide. You need to do the risk assessment and the remediation plan and update them regularly. And regularly means typically on an annual basis. Whenever you have a change to how you operate, or you put in a new piece of infrastructure, typically on the IT side, but also with physical security. And we recommend that you update your risk assessment for the relevant items whenever you have a security incident, because that goes a long way to showing the regulatory agencies that you're taking this seriously, which can keep you from being assessed fines and penalties at a later date, and gives you an affirmative defense if you find yourself in the middle of a civil suit over a breach that occurs. So what does NIST mean? So typically when you see a risk assessment, this is what it looks like. It looks like a series of yes or no questions. This is actually a slide from our software. It's called HIPAA Suite that we use to manage HIPAA compliance for our clients. But what you need to understand is behind this yes or no question is a multivariable matrix. So what does that mean? So for every threat, and there are 132 threats that are outlined in the regulations, you need to assess a probability or a likelihood that that threat is going to come to pass. And then if it does come to pass, what's the level of impact that it has on you as an organization and on the individuals whose information has been compromised because that vulnerability has come to pass. So behind those yes or no questions is a multivariable algorithm, and typically you end up asking about a half a dozen questions for each one of the threats in the regulations to build up what's called a robust risk score, so that we can assess which vulnerabilities we need to look at first and which vulnerabilities we can push down and address at a later date. So once you have that risk assessment done, it generates a remediation plan. And this is a sample out of one of the remediation plans we generate in HIPAA Suite. So the required parts are that you have a risk score for each of the vulnerabilities. And by the way, you can see this is done by location. The risk score is associated with the threat right out of the regulation, including the regulation numbers. You need to have an action plan item. The action plan item will either be what's called required or addressable. The action plan items that are required need to be implemented as per the regulations. They're actually outlined in the regulations. An addressable action plan item gives you some flexibility. If you can defend an alternative way to get to where you need to be for that particular threat, and you can document and, as I say, defend that decision on an addressable item, you can go ahead and use addressable. Then, after the action plan item, we have someone who takes responsibility for approving what's been put in. And important to have is a target date to get this item implemented. The issue here is not so much that you hit that target date explicitly, but rather that you can demonstrate, if need be, that you're making what's called meaningful progress through your remediation. The regulatory agencies don't expect you to remediate everything at one time when you've done your risk assessment, which is why you want to address the high-risk items first. But they're going to come in when they do an investigation, and they're going to want to see that you, in fact, are making meaningful progress through your remediation. So you want to hit your target dates plus or minus. I mean, they are only benchmarks. They are guidelines. You want to try and hit them. When we do this for our clients, we typically give them 90 days to remediate their high-risk items, another 30 days to remediate their medium-risk items, another 60 days to do all the cleanup and remediate their low-risk items. And by using the plan and the target dates, we can demonstrate to the regulatory agencies that we're making good progress through the plan. So, have you corrected your deficiencies is the next step. And so what does that mean? So typically, deficiencies are going to be defined within a policy and procedure. And so here are the different areas or sections you want to have in your policies and procedures for all of them. So the first thing you're going to have is what's the purpose for the policy? Pretty straightforward. Who's responsible for implementation? So the organization, in this case, Chief Privacy Officer, may not be the person who actually implements this policy. And this policy is formulating the HIPAA compliance plan. They may not do the implementation themselves, but they're responsible and they need to be identified as being the responsible party. the scope of the policy, so what departments is it applicable to, what locations is it applicable to. Then you have the specific policy outlined, and then you go through the actual procedure. So you're going to define the policy, what it's going to cover, and then you need to have the specific steps you're going to follow to make sure the policy has been implemented and what's being implemented in the policy. Then it's very important that you have the applicable standards and regulations. Essentially, every policy and everything you do in HIPAA, you want to have indexed to the regulation number. And the reason for this is when you're investigated by the regulatory agencies, they're not going to say, for example, send us your policy and procedure manual. They're going to say, show us everything that you have around implementing your privacy and security program. And so you need to be able to go through and identify everything, whether it be policies and procedures, whether it be part of your risk assessment, whether it be your training, whether it be other documents that are related to that specific area. And the only way to be able to track that is to index everything by regulation number. So when you do your policies, you want to make sure that that, along with everything else you're doing, has a regulation number associated with it. Otherwise, it's enormously difficult, if not downright impossible, to comply with the document requests that you'll get from the regulatory agency in the time allowed. For a breach, OCR allows 20 days to get your information together, which may sound like a lot, but if you're trying to remember where you have everything stored and what is related to CFR 164.306, 20 days goes by pretty quickly. And add to that the fact that the regulatory agency is going to ask for up to 6 years worth of information in their document request. So if you don't have everything indexed correctly and stored appropriately, it's going to be enormously difficult, as I say, to comply with the document request as needed. And once you haven't done that, that puts you on the bad side of the regulatory agency, which is where you don't want to be. The ability to comply with their document request, in many cases, will shut down an investigation, assuming that you have all the information that they're asking of you. Okay, then again, we want to have a version control block, so we have the distribution part of it, and then the version history, right? Who prepared it, when it was changed. And again, this is because the regulatory agency is going to ask you for up to 6 years worth of information. They want to make sure that you've been updating as necessary and can document. In fact, you've been doing that. When the regulatory agencies come calling, if you say, well, we do that, but we don't have it documented, that's not going to fly. If it isn't documented, they do not consider that you're actually doing what you say you're doing. So you need to be able to demonstrate everything through appropriate documentation. So next item, do you have an ongoing auditing monitoring program for your privacy and security program? So what does that mean? So what you need to do is, once you have your program in place, you need to audit the what, the how, and the when. So the what is, you need to monitor goals and targets. The how is what metrics and methods you're going to use. And the when, obviously, is the frequency. So this is actually outlined in the regulations. It's something that people tend to not do, and it causes lots of problems for them moving forward. So a couple of examples. Let's say we're looking at the policies. The what would be, are you complying with the policies and procedures as written? The how would be, you go in, you do chart audits, observations, and surveys. Customized to the size of your organization. And the when would be variable. We typically put our clients on an 18-month audit and monitoring program. so that within 18 months we've monitored everything, and that shows good faith for the regulatory agencies and makes sure that we're looking good to them when they come in to do their investigations. Another example will be training. So what are we going to audit? We're going to make sure that all workforce members are going to be trained. How do we do that? We reconcile the training reports against lists of workforce members to make sure everybody's been trained. The when, this says monthly. For a large organization, you may want to do that. For most of our clients, we end up doing it twice a year, and that's more than sufficient. So again, it's going to be variable depending upon the size of your organization. And the final one to look at is safeguards. So when you implement specific safeguards, kind of like policies and procedures, but they may be technical things that you implement. We want to see that we've implemented the safeguards. We're going to do a walkthrough to make sure they've been implemented the way we've written them up. And when are you going to do that? Again, it's variable. You can do it quarterly or annually, whatever is appropriate for your organization, but you want to define those frequencies within your audit and monitoring program. And again, it needs to be something that you have in writing. Otherwise, for the regulatory agencies, it doesn't exist. Okay, a new one, not so new anymore. Have you conducted due diligence on your business associates? If you remember the breach we talked about earlier, the covered entity was held liable for over $1 million for a breach of their business associate cause. And so what's happened is prior to 2013, when the final omnibus rules actually were fully implemented, if you had a valid business associate agreement in place with your business associate and they caused a breach of your data, you had a safe harbor exemption, essentially a free pass for any breaches they caused. Subsequent to 2013, you're now required to investigate your business associates for their compliance with the regulations, and that's because the regulations stipulate that you need to be able to reasonably anticipate, identify, and protect against any security and integrity risks to your information or inappropriate disclosures. So the onus now is on you to check and make sure your business associates are complying with the regulations. Now, if you find a business associate who isn't complying, the regulations actually stipulate that you need to terminate your relationship with them if they won't cure their non-compliance, if feasible. If feasible means that if you work with someone who's the only person you can possibly work with to provide the service that they're providing, and you can come up with ways to mitigate the risk of their not being in compliance, and you can justify that, then in the very unlikely event and very infrequently used, you can continue to work with that business associate. But you really need to have a good, strong argument in writing as to why you need to continue working with that business associate, why you can't terminate the contract with them. So, training. So the privacy rule addresses training as follows. So all workforce members need to be trained on policies and procedures relevant to their job. So what this actually means is you can't just train your workforce members on general HIPAA. Like what we're doing today is kind of a general background on part of HIPAA. Obviously, it's good information to have and valuable information to have and expose your workforce members to, but that by itself doesn't satisfy all the requirements of the regulations. to satisfy the requirements you need to train on your own policies and procedures. This is one of the reasons why the regulatory agencies take the position that virtually all companies are not doing adequate training of their organization workforce members, because most organizations will once a year do some kind of generalized HIPAA, go to a webinar, go to a association meeting, but they're not addressing the training on their own specific policies and procedures, which you need to do to satisfy the requirements of the regulations. You need to train all workforce members within a reasonable period of time. So what that means is if you have an onboarding process, you include their HIPAA training into that onboarding process, you document it, and you'll be good to go. The regulations don't say it needs to be done in the first week, the first day, the first month. You can determine how to do it or the time frame based upon someone's access to protected health information. And as with everything around HIPAA, like I said earlier, you need to be able to document and maintain that documentation for a period of 6 years. Documentation needs to include who was trained, when they were trained, who did the training, what was the training about, so what was the training on, have a copy of that training available, and again, you need to be able to maintain that documentation for 6 years. Again, your training must occur on your own policy and procedures. So summary of the high-level requirements are you need to complete your security risk assessment, and you should also do a privacy risk assessment. That'll percolate up all the high-risk vulnerabilities that you have. Then you produce your remediation plan to correct the deficiencies. Provide the workforce training on your specific policies and procedures. Implement an audit and monitoring program to manage your compliance. And complete due diligence on your business associates. So, with that being said, let's talk briefly about what your compliance choices are. So how do you get to this compliance? It's a lot to have to address and a lot to have to be concerned about, particularly if you don't have people who are trained and qualified to address all these items. So your first compliance choice is to try and maneuver through HIPAA, privacy, and cybersecurity rules all by yourself and essentially risk everything, be on the hook for the kinds of fines and penalties we saw at the beginning of this presentation. Your second choice is to have a full-time privacy and security expert on staff. Typically, those folks are going to make between $100,000 and $180,000 a year, depending upon the level of the expertise. And you're only going to need them for about 10 to 20% of the time. I think that's actually a little bit high. Maybe 5 to 10% is more accurate. You can also try and train your employees to become qualified in HIPAA and cybersecurity, but then given they can go out into the market for a job at $100,000, $180,000, it's going to be difficult to keep them on staff. Most organizations can't afford that kind of a line item budget for one person who's only going to work 5 to 10 to 20% of their time on what they're being trained on. So what if you could hire a true HIPAA expert to make sure you're compliant for the cost of what a full-time person was being paid at minimum wage or less? So now you can do that. So we at ANCHORAGE want to be trusted advisors that address all your HIPAA concerns and get you compliant, keep you compliant, and you can count on us. So what you'll get, we have 2 different programs. We have something called HIPAA Express, where it's a one-day workshop. We bring in groups of practices, and we give them guidance from a certified HIPAA expert. And risk security risk. We develop the remediation plans. We then do webinars to customize their policies and procedures. This is a 13-week cycle, once a week for an hour and a half. And so if you miss one, you can come back 2 months later. And we do the business associate management, so you can be sure that you're managing your business associates as required. Our other product is what we call HIPAA Select, which is a custom one-on-one. It includes all the items in HIPAA Express except done individually. It also includes the ongoing security and privacy audit program. We do all your staff training, and we do an ongoing evaluation. Whenever we have a security incident, we will assess it to see if it needs to be reported. And if it does need to be reported, we'll actually work with you on the reporting, so we stand side by side with you to make sure that you get through the investigation if there is one appropriately. So the first step actually is to figure out where you are in your security program. So it's important to know how your security program stacks up. And so what we have is what we call HIPAA Diagnostic. It's a 20-minute free, no obligation, high-level assessment of your privacy and security program. It's based on what we've discovered Office for Civil Rights finds that people are not doing. So we're covering those items at a high level that you need to make sure you have in place. It then provides for you a report to management on your status, and then you also get a consultation with an expert in privacy and security to go over the diagnostic with you. So you can register for that if you like at HIPAAdiagnostic.com, or you can call us, and we should actually have a live link in the chat. Which we do. So feel free to go ahead and register for that. So at this point, I know we're almost at the end of our time, but anybody have any questions? And by the way, when you log off, this will be a quality survey we'd like you to fill out. It's at this link here, which is not live for you, but again, you'll automatically be taken to that when you log out. So any questions on what we covered today or any other questions you might have around HIPAA? Okay, here's one question that came in. Let me paraphrase it. They're saying, I've heard a lot about audits around HIPAA. How likely am I to be audited? So, good question. HIPAA audits are very infrequent at this point. That's not what should be concerning you. In this last audit cycle for 2017, only 156 organizations were audited. You're more likely to end up being contacted either because you've self-reported a breach that you've had, or someone has filed a complaint against you, or one of your inside workforce members will go ahead and file a complaint. So you shouldn't be terribly concerned about the audits, although you want to be prepared for them. What you want to be concerned about is addressing an investigation from a breach that you've had, again, self-reported, or if someone has filed a complaint because they don't feel like you've been following the regulations. Good question. Okay, here's another question. How often should I do this security risk assessment? Well, as we said, the state of the industry is you do it once a year, although you can blend that into your ongoing audit program. It kind of covers much of the same ground. So you can be doing the risk assessment as you're doing the audit piece, or you can just sit down and get the audit done. I think it's enormously important that you review those portions of the risk assessment that are relevant to any security incidents you have as a way to try and understand why your systems and processes failed you and the security incident occurred. So again, do the risk assessment annually, do it whenever you have a security incident, and do it whenever you have a change to how you operate, whether it be physical infrastructure, technical infrastructure, or operational items for your employees. Okay, I will stay on for a couple more minutes, see if any more questions come through, but I want to thank you for attending our webinar today, HIPAA, the Road to Compliance, and hope to see you at one of our upcoming webinars. Take care, have a great day.